Good morning to all. Today I'm going to present my work on long-term outcomes of needle-assisted circumferential goniotomy in primary congenital glaucoma. As we all know, primary congenital glaucoma accounts for 0.01 to 0.04% of worldwide blindness and is characterized by maldevelopment of trabecular meshwork. The definitive management is surgical, which can be angle surgery or filtering surgery. The advantages of goniotomy include that it's a minimally invasive procedure with a conjunctival sparing technique, and it avoids a long-term bleb related complications. It's also a cost-effective procedure. So traditionally described angle surgery opens about 1/3 of the angle in a single step, and hence there might be a need of multiple procedure to open the entire angle. So currently we are considering 360-degree procedure, and hence we performed a prospective analysis on surgical outcome of 360-degree goniotomy in primary congenital glaucoma patients. So infants who presented to congenital glaucoma clinic were screened, and we included 52 eyes of 31 patients who were of less than 2 years and had good corneal clarity. We excluded those who had dense corneal hairs, who had secondary childhood glaucomas, and parents who were not willing to give consent, and age more than 2 years were excluded. So after doing an evaluation under anesthesia, we performed a nasal goniotomy by using a bent 24 gauge needle, and we inserted that needle from the temporal limbus and performed the nasal goniotomy after visualizing the angle using a Schwann-Jacob lens. The high iris tissue insertion was incised and iris fallback was noted. Similarly, temporal goniotomy was performed by inserting this bent needle from the nasal side of the limbus, and similarly we did the procedure of goniotomy and followed by irrigation and aspiration to remove all the viscoelastic substance, and the anterior chamber was formed and the wound was hydrated and sutured. So this is the pre-op high iris tissue insertion which was noted, and post-operatively iris fallback with an opening of cleft after goniotomy was noted. The patient was followed up immediately on day 1 week, 3 months, 6, 9 and 12 monthly, and at each follow-up we determined IOP and total number of anti-glaucoma medications. Absolute success was considered when the IOP was less than 18 mm mercury with no anti-glaucoma medication, and qualified when the IOP was less than 18 on less than 2 anti-glaucoma medication, and failure when the IOP was more than 18 on 2 topical anti-glaucoma medication. So this is the mean pre-op intraocular pressure, which was 23.28 plus minus 5.9 mm mercury, which was reduced to 12.5 plus minus 5.09 at 12 months. And which was a statistically significant reduction, and also the mean number of anti-glaucoma medication reduced from 2.48 plus minus 1.03 to 1.35 at 12 months follow. These are the baseline characteristics. The mean age was 1.14 plus minus 1.04 years, and the IOP and the anti-glaucoma medication had already been discussed. The mean cup disc ratio was 0.6 plus minus 0.2. Coming to success rate, complete success was seen in 40% and qualified success was seen in 48%. So at 12 months, around 9.61 eyes required additional surgery, which was trabeculectomy, and the complication which was seen was hyphema, which was managed conservatively in 19.23% of eyes. So why 360-degree goniotomy is needed? Basically, aqueous outflow channels are not symmetrical, and the entire angle is treated at one single step. There is no need of multiple anesthesia to the child, and there is a reduction in the parental stress. It's also a cost-effective procedure. A study conducted by Maria Lim et al. Had shown 360-degree trabeculectomy with illuminated microcatheter to have success of 85.71% as compared to partial trabeculectomy in terms of intraocular pressure and AGM at 1 year. Also, trabeculectomy or combined trabeculectomy with trabeculotomy will lead to manipulation of conjunctiva and use of antimetabolites and will have bleb-related complications. So there are a few studies by Kaushik et al. Who have compared goniotomy for initial and redo surgery, and at 1 year they had found a success rate of 79.7% in a primary surgery and 68.4% in a redo surgery. Mendicino et al. Have conducted study who have evaluated surgical and visual outcome in primary congenital glaucoma, trabeculectomy 360-degree versus goniotomy, and they had found intraocular pressure reduction of in 92% of eye in 360-degree trabeculotomy versus 58% in goniotomy. Tonsett et al. They have evaluated circumferential trabeculotomy in primary congenital glaucoma, and complete
Dr.
success
Anuja,
was
your
seen in
time is up.
85.
Can you conclude your presentation, please?
So to conclude, patients with pediatric glaucoma often requires multiple surgeries to control intraocular pressure, and this study basically highlights the benefit of circumferential goniotomy, where entire angle is treated in one single step with significant reduction in intraocular pressure and anti-glaucoma medication. Thank you.